Dr. Jenna Khoury with the Pediatric Dentistry. I'm here today with Jennifer and her youngest, Bennett, who had a tongue and lip revision just about a month ago. And Bennett has been through quite the journey. Jennifer, just a little bit of background, has 3 older children, 4 in total, and she has a master's in nursing. She's a nurse practitioner. She's part of our medical community, which is why I felt like her experience was so important to share, and she's so lovely and willing to share it with us. So Jennifer, maybe you could give us a little bit of background about Bennett and what your journey's been like so far.
Okay. When he was born, he was full term and he weighed 8 pounds. And when he started nursing, everything seemed fine in the beginning. After a couple weeks, his weight dropped, which did happen with my other children.
Right.
A slight drop.
Right, slight drop's totally normal.
Yeah, and so I thought, okay, we're going to keep an eye on this. Went back to the doctor more often, and the weight just kept dropping. By the time he was 4 weeks, he weighed 7 pounds, 8 ounces. So he wasn't gaining at all.
Alarming to you as mom, and you've had 3 children before, and you're in the medical community. So you have an idea already of
something's not right.
Exactly.
Yeah. So at that point, I also noticed that my nipples looked different when he was nursing. A lot of gas, acid reflux. He just didn't latch the way he did in the beginning, and it didn't seem right. Kept going to the doctor. They said it was this allergy, that allergy. He tried 3 different formulas. Nothing worked. He did make it up to about 8 pounds, but it still wasn't, they need to gain about 6 ounces a week.
Right.
It was nowhere near that. So at that point I started researching on my own on the internet because I was so worried, and I was reading about lip ties, and he had all the symptoms. So I flipped up his lip, and sure enough, it looked to me, who's not really trained in that area, like he had that.
Sure.
Which way I found you.
Right, and what I want to make clear here is that Jennifer did the right thing. She approached her doctors, multiple doctors, to sort of get some advice, and ultimately found her way to a pediatric dentist, which I feel very blessed to have been part of that journey. Now, ultimately, what I want to get at this video is that just because one doctor says no, there's nothing there. If you're a mama, you have your gut instincts. If you feel like there's something going on, then there's something going on. And now you were sharing with me that Bennett was placed on reflux medication, was given a special type of formula, and he just wasn't even able to take a bottle at that point, correct?
No. So when I was pregnant with him, I assumed that he would be breastfed, and when I went back to work, I wanted him to have the big nipples that are more breast-like. He could not take that, so then I bought the really small, old school, even flow nurser type thing. He couldn't even take that. His lip would get stuck underneath, and one thing that my daughter kept saying is, why does he keep getting that ring on top of his lip, which I read was a symptom, because he couldn't, even that tiny little nipple, he couldn't suck right.
So couldn't latch properly. And look at him now, he has the passy, and he's happy.
Yeah.
So maybe you could tell us some really great news about his progress.
So when he did the surgery, he was 6 weeks, 2 days old, and he weighed 8 pounds, 5 ounces, and he now weighs about 11 pounds. He's 10 weeks.
Wow.
So immediately, the first week he gained, I think, a pound, just in the first week alone.
Which is, for him, for any child, a pound in a week is a lot.
Yeah.
But then on top of it, for Bennett in particular, feeling like that relief you must have felt.
I mean, I knew that was the answer. Everybody kept having all these scary scenarios, and this is wrong and that's wrong, and going to specialists and blood draws. And once he had that surgery and I saw him gaining, I mean, everything about him changed. His skin color changed, his face changed, everything. I was telling you I was scared to even give him a bath because I knew that the expenditure of calories from shivering, I mean, when you have to get to that point where you're so worried about your child to see that.
He was diagnosed failure to thrive.
Yeah.
So as a mother, and a mother of 4,
yeah.
It's alarming for any mother, but on top of it, a mother who has been through it before and knows what the steps should look like.
Right.
I can only imagine, and I'm so excited. I can't believe 3 pounds.
He's gaining so fast now. He's catching up, and
he's so happy. We've got cheeks going.
No more reflux medicine.
No more reflux medication. That's amazing. Oh, I'm just so very excited, and I'm so happy, and thank you from the bottom of my heart.
Thank you for being there for us.
And thank you for letting me be there for you. It's just been so exciting to see his progress and just be a small part in the big life of Bennett.
Yeah.
Thank you so much and have a great day.